Yesterday, we have 14 new cases today. That includes 9 on Oahu, 2 on the Big Island, 2 on Maui, none on Kauai, and we're still looking at 1. Keep in mind that we get these reports and some are only hours old before we're reported to you, so they're still collecting information on some of these, but you might be interested that on Oahu, 9 of the cases, all of the cases were Hawaii residents. They weren't visitors. Same's true on the Big Island. On Maui, 1 was a resident, 1 was a visitor, and again, we have 1 that we're continuing to evaluate, which I think reinforces the point that a lot of the virus that's being introduced is introduced as a result of Hawaii residents coming home, being exposed somewhere else and coming home. So that's continuing to be a...
Dr. Anderson, can I ask you to lift your mic up so that people online can hear? Thank you.
Okay.
Maybe because the remainder are independent.
Thank you. I hope they heard what I said. I won't repeat it unless you'd like me to. But let me tell you a little more about the lab testing. There's been, of course, a lot of discussion about that. To date, and of course these numbers change by the hour, but today we have reports of a total of 5,747 lab results that have come into the state through both the clinical labs and our state lab. The clinical labs are doing the vast majority of the testing. That includes CLH and DLS. In fact, together they've tested so far 5,379 of the 5,747. Our state laboratories division, which serves as a reference laboratory, has tested 368 samples altogether, which includes samples that are being run to confirm private lab testing, but also the lab samples that we're using to the testing we're doing in our Sentinel survey. Dr. Park can talk more about that. You've heard about it, but we got another lot of 26 results back today. They're all negative. And the significance of that is that although we are now finding a few cases that seem to have be the result of localized transmission, no history of exposure to travelers or no history of travel to areas where COVID-19 is widely being disseminated. We don't believe it is now circulating widely in our community. Nevertheless, it's an indicator that it probably is being transmitted locally between people, and that's obviously a point of concern. Almost exclusively, we're seeing the illness associated with travelers early in the course of this epidemic, and now we're beginning to see signs of local transmission, which only reinforces the need to implement very, very stringent measures to keep it from circulating widely in our community. And I think there are, of course, measures in place now that are effective in that way. Our social distancing is the objective with almost all these measures, but the restrictions on closures of bars, restaurants, and all the other things that are happening are, of course, supportive of that. And the main message everyone is getting is, stay at home if you can, work from home wherever that's possible, and don't expose yourself to others or be in a situation where you're going to be exposed. And I said this once, I think maybe last meeting, that it's rung well, and as I've heard others say it, and that is that if you should think about yourself as being infected, even if you're not, and that other people around you are also infected, and that way I think it helps to give you a sense of how serious this problem really is, and how we should be thinking about our movements and what we're doing every day. So that's the update on the cases and our lab support. We're going to be continuing to do what we are doing now, which is to aggressively pursue any cases that are identified. Again, these are usually identified, in fact, are in all cases now being identified by private physicians through private laboratory testing. I might add that the private labs are now able to do much of their testing locally. They may be splitting some samples to send to the mainland, which takes now over 10 days in some cases because of the backlog that laboratories in the mainland are having. But if they're done locally, they can turn the results around pretty quickly, sometimes in a day or two. Our laboratory is able to test and provide one-day turnaround times. If we get the sample before 11 in the morning, we're likely to be having the results by the end of the day. That's just for reference purposes. So if we get a report from a private lab that a person's positive and we confirm that, we can usually confirm it pretty quickly. But the front line in this epidemic are the physicians who are seeing patients who are symptomatic, and of course they're then referring them to us for follow-up, and that's really what we're doing now. I should add, I think you probably had others speak, or you're going to, on the 14-day quarantine. I'm sorry, have you had anyone from DOT or others come to talk to you about that? I don't want to repeat what they've said, but it seems like it's working. The numbers are way down on the people coming to us from other places, and there's some consideration now about banning or requiring 14-day quarantine for inter-island travel as well. I'm not sure if final decision's been made on that. I'm sure there are going to have to be exceptions to that if that is implemented, but that's being discussed. So that would essentially shut us off from other jurisdictions where the disease is occurring and help protect us against the importation of the disease. But it's certainly not going to help when the disease is already here, and we still need to go after any cases we have and contacts. That's what every other jurisdiction, every other state's doing. I think we're doing it better than most are. Our numbers are down. We're able to thoroughly investigate the cases that we know about and identify contacts, and of course they're being quarantined if they're close contacts. If the numbers get much bigger, we're going to have a much more difficult time managing that. But right now, I think we're doing pretty well, and I think that's helped to keep the numbers down as it has been since this outbreak first occurred. I wouldn't count on that happening forever. We all anticipate a time when we're going to start seeing much more community spread. It's practically impossible to avoid, and our challenge is to keep the numbers down to a level where we can manage the cases that are occurring, and of course tamp down the numbers as best we can through our contact investigations and so forth.
Thank you. We have 3 senators also joining us online who have now been in quarantine for 8 days. So the good news, gentlemen, on this, our senators, is that if 10 days is usually the max, 2 more days and maybe you'll hear something. So I believe Senator Keohoko has a question. Is this for Dr. Park or Dr. Anderson? Go ahead.
I have a follow-up question for Dr. Park based off of a couple of questions I asked.
Sure.
I think it was 2 days ago.
Sure.
Okay. So I believe Dr. Desmond indicated that there are the current daily testing capacity is 1,000 or less tests that can be administered on a single day. Taking into account the Department of Health is qualifying symptomatic criteria, is that 1,000 or less daily test capacity sufficient for the demand that we're currently experiencing?
Well, demand right now seems to be being met as far as we can tell, in that clinicians are ordering the tests and are referring patients to the clinical labs as I directed them to do so starting on Wednesday with the latest. We're issuing medical advisories weekly to the clinicians to provide them the most up-to-date guidance, and considering that the clinical labs had indicated they were ready and already running and very close to completing validation. In fact, one of them has completed in-house validation. The other one CLH is...
Kaiser's up and running,
Yeah.
CLH and DLS.
Right. So the validation, CLH is completed validation. So yeah. So all the labs are now up and running in terms of having in-house testing capacity. So based on that, that's why I issued the medical advisory. One of the guidance in there was to direct clinicians to order tests directly from the clinical labs, so that they could go through usual practice, so to speak. And in that's what normally happens. They're not usually ordering tests from the state lab, which is, as Dr. Anderson said, is a reference laboratory, not really a client, related sort of laboratory. So as far as meeting demand, I mean, hard for me to say yes, no, because I'm not out there. I just see what's the numbers that are growing, and I also hear from colleagues and friends who are clinicians, my clinical colleagues, that they are able to order the test. So I mean, that's the best I can tell you at this point.
Close again.
Well, I think that's helpful because you are the best situated to make a determination on any particular day whether anyone in the state of Hawaii who needs a test based off of their asymptomatic criteria will in all likelihood have access to one. It's just a question of, because I guess there was a question I just would like to confirm that.
So
based off of your message.
Sure.
So that's what I mean.
Sure. So as far as we're aware, the clinical labs are ready, and again, they're running. They're able to turn around those tests. I'm sorry, your tests got sent to the mainland before they were ready. But as far as the testing capacity, we have it now in the state, which is a good thing. But of course, as you heard the last time we talked with you all, there are still issues around supplies. Dr. Desmond, who is now here, by the way, has indicated he's been communicating with the laboratories, and they have indicated that they're still experiencing continued intermittent supply issues. The other thing I would just caution is that my concern is more about, in terms of access to tests, the answer would be yes, theoretically, but then we also have to think about it is Hawaii, and we have always had the issue of healthcare access in general. So it's not even just the test, but just healthcare access issues, and that may be something to consider. Hopefully our federally qualified health centers can meet some of those needs, but we know also that there are some individuals out there that still have problems accessing health care.
Let me mention one problem that we're just hearing about. That is a lot of private physicians, not a lot, but quite a few private physicians are closing up their practices probably because of concerns about COVID-19. Many of them, are not used to dealing with infectious disease issues like this, or they have other reasons to close.
Well, it's a PPE issue too.
It's a PPE issue, right? Many of them aren't used to wearing PPE or don't have any supplies in stock. That's concerning because that, of course, puts an increased burden on the other medical facilities, the hospitals and others who might be there. And actually, I was hoping that if this is broadcast, it might be helpful to mention that individuals who do not have a physician anymore can contact our federally qualified health centers, and we do have physicians there who can see patients if your physician is no longer practicing. But I think this is going to get to be more and more of an issue. It's not just the lack of supply. I think there's just a general concern about a physician's inadequacy in dealing with the issue, and there may be financial and other reasons why they're closing. But as this happens, just know that we are wanting to support the private physicians in providing equipment, supplies, if that's the issue, and if there are other issues that we simply can't help with, then there are alternatives for those individuals who may be seeking services that they can't get anymore. So I think this is a problem we didn't anticipate as much as we might have, but it's another one that we're working through right now.
Dr. Anderson, besides the senators who are online with us, we are broadcasting this on Olelo, channel 56, I believe. So they are hearing your message. I would ask, though, maybe if you could let the viewers know how to go to your website to see that information that you just talked about.
We are actually, for those who are interested, we put out a press advisory every day with updated case information, but also there are various bits of information that we're putting out there which would be valuable. That does include a number where people can call or contact if they are in need of a physician. All the testing that's being done has to be done through a physician. That physician has to be able to evaluate the individual and provide medical advice both before and after the test is done if a decision is made to do the test. So it's critically important that an individual who's symptomatic or otherwise talk to their physician about this, because the physician has to order the test. And then, of course, that physician is the one who's going to be following up with the patient. So I would hope that they would read that information on our website, and we do put this out in a news release, so the newspapers may pick up on that as well. But that just went out today. And by the way, there's one other bit of information I can remember. Dr. Desmond's here, but we're concerned that there's a lot of people out there selling their test or their test kits or whatever the case may be. Some test kits are probably okay. Others are not. They haven't been tested. They're for research purposes only, or they're just simply not reliable. They're not specific or sensitive to COVID-19. And in which case, of course, having a bad test result is probably worse than no test result. It gives a person a false sense of security if it's positive, and if it's negative, or negative, I should say, and if it's positive, of course, they would be worried needlessly. But having a test that's reliable is important, and there is an organization called CLIA, and I hope Dr. Desmond could come up at some point and talk about that certifies laboratories. But if you can just remember this, that the test should be CLIA certified in order for it to be used. The clinical labs that are now testing for us in our lab are all CLIA certified. But there's lots of stuff out there that people are selling or advertising that is not reliable. Test kits that can be, promising a half an hour turnaround or, on the spot analysis are not necessarily reliable enough for our purposes, certainly, and for others as well.
Senator De La Cruz has a question.
Last time we met with the Department of Health, they had mentioned that the South Korea model has some expense to it and would need some manpower. Is it still possible for the department to draft a more aggressive plan that it seems to me that the department is in somewhat agreement with to the governor to see what we can try to at least fund and expedite and do whatever we can to try to come up with a similar plan that fits Hawaii's needs?
Well, South Korea has I think, a very comprehensive program. They have done a lot of testing of people. Dr. Park shared with me a statistic that I think was interesting to me. Apparently, they've tested about 7% of their population, give or take a little, but that's approximately what they've done. We've actually tested now over 3% of our population.
Probably 4% at this point.
Almost 4%, and we're only beginning into this, so we're actually not far behind in terms of tests per capita. And I would argue that our testing is probably more focused on people who are symptomatic and probably more valuable than just simply going out and testing everyone who wants to be tested. So I think we're actually not far behind, but what South Korea did that I think we've done really well is, of course, close our borders. They also have a 14-day mandatory quarantine, and they've taken very stringent actions in requiring people to stay at home. They've closed bars and restaurants and done much of what we've done. So our program is modeled largely after theirs in what we're doing. Of course, looking at other countries, New Zealand, for example, has a quarantine program that's even more stringent than us. They simply ban anyone from coming back to New Zealand who's doesn't have a New Zealand passport. So they've actually had more restrictive travel conditions than what we have now. And there are other countries as well that have taken actions, everything from curfews to other actions to help to enforce social distancing that I think are noteworthy. And I think what we're trying to do is find the best of the best and looking at what other countries are doing that are effective, that could be implemented here as we go forward. And we're learning as we go. Everyone is kind of in the same boat. No one argues that we shouldn't be acting very aggressively and early. The biggest mistake that the countries have made that have a huge problem is they didn't act quickly. I think we're lucky not to have had a lot of cases, and we are really early considering where we are in the epidemic curve. So I think we've got an advantage over those other places in many respects. And of course, we're an island state. We can control our borders much more than other states can, and we should be taking advantage of that as much as we can.
You know, when it comes to, I guess, disaster, weather kind of disasters, if you have a cellular phone, you often get some kind of text message. You hear it when we're in meetings and everyone starts beeping. Is there going to be some type of arrangement with cellular companies to treat this virus or this pandemic in a similar way that we deal with the natural disasters?
I'm trying to understand how we would alert, because the alert is here. I mean, we have cases here, and there's even already a few cases of localized transmission, so there's no...
So every day, everybody would get a text from the Department of Health saying, these many more cases, stay at home, all the things that you want people to do. Just keep reiterating every time there's a new update. Similar to when we have weather disasters.
Yeah, I think we'll find better ways probably to get the word out and to bring people up to date on cases and so forth. And certainly as we get more community transmission, as we anticipate we will, maybe we can come up with some sort of a warning system like they have. But we're not dealing with a hurricane or tidal wave, which is very predictable. To be honest with you, we haven't seen a huge wave of new cases as they have in many places. We expect that might happen, and we're preparing for that. Perhaps we could come up with some sort of a public notice system where we could alert people as to the current condition. I know General Har is going to be here later today. He mentioned to me he would be, and he'll be talking about various triggers that they're planning around and actions to be taken when we reach those triggers. So short of a cell phone type alert system, certainly the emergency management agencies here will be implementing plans based on in part at least based on the conditions as it relates to the transfer of the disease, and possibly ramping up even further our controls. I'll let him speak to that.
Other countries have adopted similar measures with using cellular phones as a way to notify the masses.
Yeah, one thing that's really that we are doing is we're using our cell phones to track visitors and others who are under quarantine. That's actually something that's we found to be very efficient, very useful, in lieu of having to watch the person or to try to follow their whereabouts. So that is a good application for a cell phone. And we'll if there are some good ideas that other countries have put in place to keep people informed, we'll need to look at those. And certainly, I'll ask our communications folks to see what might be available.
So, one question, communication. Just if you're dealing with your communication folks, I know that you've been working on this and social media, but the millennials, we've seen, are the least likely community to really adhere to the social distancing. So I think what's being asked by Senator De La Cruz is not only the number of cases and whether we're spiking or moving closer to a surge or whatever, but at least at those messages come in, we've got more. You have to do these things. If you have these symptoms, we've just learned today what is symptomatic, then please, keep your distance. These are things to do so that at least I know they look at their phones all the time, that this would be a way of getting to those who think it's really not their problem.
Yeah, we just retained, I may have mentioned this last time we met, a consulting firm to help us with messaging, particularly for the younger people via social media, Twitter and Facebook. Yeah, that's the way they communicate, and that's the way we should be communicating with them. And we could perhaps work in first of all, we should do some regular messaging and hopefully messaging that they'll listen to and pay attention to. But there could even be some sort of a alert kind of a system built into that messaging that we can use. So
the news stations do it regularly with breaking news, so maybe we could do breaking COVID-19 news. Senator Kim has a follow-up to the messaging
just a
issue.
follow-up. You had mentioned that you can track by phone. Are you using some kind of app? Because I know that South Korea has an app that they can, for all the visitors that have the 14-day quarantine, that they can monitor and have them report back in or something like that. So is that what you're talking about?
Yes, exactly. I'm not sure that they're required at this point to have the app, but there was certainly some discussion around that. That would be a good question for Director Hara when he comes to ask him about. That would be implemented through the Department of Transportation encounters when they come by
So
plane.
how are you keeping track of them? You said you're keeping track of them by phone. How are you keeping track of them?
We've kept track of the contacts that we have, and of course the cases.
Right.
So we've focused on those where we, the health department, have not been engaged.
People with real risk, essentially. That's how we're keeping track of that.
The group that I think you're concerned about are the travelers who are now subject to the 14-day quarantine.
No, I was just wondering if you had some kind of an app keeping track of those that you're keeping track of. So you're just doing it by the contacts?
By contacting them directly, because if you can imagine, if they walk out of the house without their cell phone, not very useful. So we're requiring, for certain ones, we do video call and others, phone call, but we keep in regular contact with individuals, it's also, making sure they're okay, right? So.
But again, Director Hara I know he's looking into that. You're correct. In South Korea, all the travelers are required to have a cell phone number, and they actually have to report in twice a day as a requirement of their quarantine. And then, of course, you'll be able to contact them just to check in on them at other times. So that's a relatively inexpensive way of handling that. Certainly a lot better than posting a guard at the door and making sure they stay home.
Because they can't be released until they download the app, from what I've read. So.
Right. Good idea. And that's one of the things that I think South Korea has done that's I don't think others have done that is helpful. Of course, you have to have someone man the phone banks and be able to be sure they're following these individuals, and that's resource intensive. Nevertheless, it is a very good tool.
So just to follow on to that, because the Department of Transportation said that once they release, they give them the instructions for the 14-day quarantine, but they don't know what happens after that. HTA will help transport them to wherever the traveler is going, but where is that end point, and do they report to you? Are you coordinated with DOT?
Again, that would be a good question for Director Hara. He's familiar with the procedures, more familiar than I am. I believe if they're staying at a hotel, they notify the hotel the visitors coming and that they're going to be subject to the quarantine. So there is contact with the management of the hotel, and I presume some oversight at that level as well. Of course, what happens?
Data. You don't get
no, the health department is focused pretty much on this, the
Focus on
cases
sick
and
people.
context.
The
Yeah.
sick people, that's what we're focusing on.
Yeah.
Most travelers now are probably taking precautions, so, if they're well, that's fine. As long as they go through their 14-day quarantine and they're fine, then they're fine to go back to society, and we don't really need to focus on them. I don't think you want us to.
The sick people that we've been monitoring, I must add, have been very compliant. I can't think of a situation, maybe one or two out of all the ones we've been following over these last couple of months that have intentionally violated their quarantine. I think they're realizing that they are a risk to others, and for what it's worth, they've been very compliant, recognizing the seriousness of the situation in staying at home, basically, and not exposing other people. That's good. That's good news.
But the other issue is really, as we've moved to this model now where the clinicians are, really able to order the labs order the testing from the labs, I think it's good to remind you all and to everyone out there to understand that we move back to what normally happens with a disease, and that it's the physician is seeing the person, and what we constantly are reminding the physician in the labs is report immediately as soon as you suspect. And the person themselves may have been sick for a little bit before they actually see their physician. So there's that time that we've lost to make sure that person is staying isolated. So this is why underscoring the need for everyone to understand that if you're sick, stay at home, except when you're seeking medical care. And when you seek that medical care, make sure to call ahead and talk about whether you actually need to seek that medical care or not. Because if we all followed that simple message, that would drive down, the numbers of cases out there. And so as we keep going forward, and people are getting their tests ordered through the clinical labs, the department is not having immediate visibility on these persons, and so there is going to be a lag period before we're notified. And so, again, underscoring that message of if you're sick, stay at home, so that when we are notified and we're following back, we're not finding that that person was out and about and is still at work, or, going grocery shopping or something like this. And hopefully all the measures that have been enacted now by the mayors and the governor will help towards that. And I agree with you, Senator Moriwaki. I mean, it will be important to keep messaging to the community, to our community, to, follow the direction of, staying home when you're sick.
You had mentioned the federally qualified health centers for people who don't have docs, because there are many of those who don't have them, and how that message could go out as well, that is free, because we want you to be tested if you are symptomatic or something like that.
Yeah.
We'll have to get that out also to the younger people. Senator De La Cruz, I know, wanted to talk a little bit about the things that we are doing going forward. That I may mention a few of those if I have just a moment to do that. I think it might be of interest. In fact, I think while we're speaking here, there's an announcement by the city, state, and probably Mayor Caldwell that we are standing up a quarantine facility in Evil A for the homeless who are experiencing COVID-19 symptoms. These are individuals who are medically fragile and waiting test results, or people who are positive for the disease. It's supposed to be operational this Wednesday. It's a facility down in Evil A that can handle up to 60 people. Lots of people are worried about the homeless and the fact that if they are sick, there's no place for them to go. Well, there will be a place now where they can go. That is as of Wednesday this next week. So we've sort of filled that puka a little bit. At least in the short term, we'll have a place for those. Also, that is HIEMA, Department of Health, and the counties are identifying hotel rooms, hotels with many rooms that can be repurposed for quarantine and isolation if necessary. And they're doing so on all islands. There's a team, I think they're on Maui today, but they're going through the islands to identify hotels that can be converted to quarantine or isolation facilities. So we'll have a place for those people who don't have homes or lodging to go to for quarantine across the state. And again, Director Hara can speak to that. And Well, and I just wanted to mention, because it's been a concern, that we are establishing priority for first responders, for the medics and healthcare workers and firemen and others who may be exposed. Those developing symptoms will be prioritized for testing. They're obviously critical to our workforce, but there was a lot of concern about those individuals having to wait in line to be tested. But they will be flagged and tested quickly by the private labs and if need be by our lab. So those are some of the things that we're looking at in the near term and focusing on those. Overall, there is a huge effort ongoing to ensure that the hospitals have capacity to deal with the surge that might be occurring. And Lieutenant Governor and others are looking at how to best deal with that. Hilton Rathel with the Hospital Healthcare Association is working with virtually all the hospitals, long-term care facilities, dialysis centers, and others to be sure that they have the medical supplies and equipment they need, and also that there is a capacity to expand their number of beds to meet the short-term and long-term needs that we anticipate. In fact, there's discussions underway, and I think they've made some decisions about the repurposing of places like the convention center if we need a large hospital, if you will, or at least a place where people could be supported if this were to become a situation like New York or some of the other countries we've seen, that we'd have a place for literally hundreds of beds if we need those. Hopefully it'll never come to that, but I think there are plans being made to be sure that we can support these individuals at least as much as we can with the resources that are available. So we're looking at a long-term plan that hopefully won't be necessary, but if it is, we'll be able to do that.